Okay, let me simply introduce ICON. ICON is a BC emergency digital emergency program. Is conducted by Dr. Kendall Ho. It's been gone on for 17 years, and it will give to multicultural community patients and the family, giving everybody the chronic education, prevention, and self-management, and through the health webinar and also using online information, it can increase the patients knowing the management and also the lifestyle and also prevent and reduce the risk. And also at the same time, it would promote communication between community members and health professional, and also optimize the people's knowledge of digital information and improve their life quality. Okay, well, so today we have many speakers to talk on many topics. This is to strengthening health and wellness as we age, to understand frailty. This year, we only had one webinar just for one day. Today, we arranged for 3 hours to broadcast here. Our Q&A will be postponed to August 19. Please pay attention. But today, you still are able to pose your questions. Okay. Today, we are very fortunate to have many medical VIPs talking to us many aspects of frailty, to share resources, and also as we age, to strengthen our health. And we have Dr. Thomas Ho. He's a family doctor. Amy Yu, she's a registered dietitian. Wendy Lam, registered occupational therapist. Nicole Tai and Emily Peck, registered physiotherapist. Dr. Tigerson Young, clinical psychologist. Ken Lin, community pharmacist. Winnie Lau, registered psychiatric nurse. Thank you to all of you to take time from your busy schedule to take part in the webinar.
So this morning we have learned a lot, and we have 2 more guest speakers to share with us on different topics. And just now, Nicole and Emily, did you do some simple exercise? Yeah, to stretch and to stand up. And I did that because I've been sitting for quite a long time. So when it's safe, you can try that. You can stretch your body. And now let's listen to the other 2 guest speakers. Just now, our guest speakers mentioned, and Dr. Ho also mentioned, like the medication management, and some medications would affect your functionality. And Wendy just now mentioned some medication make you feel dizzy and reduce your balance and make things easier for you to fall. So when you age, you have more and more medications, and so we are quite fortunate to have Mr. Ken Ling, a registered pharmacist, to talk about medications and seniors, how to manage medications. Hi, Ken. Hi, Barbara. Yeah, the floor is yours. Yes, thank you so much for ICON for inviting me again to talk about medications. And you've listened to my lectures before. We talk about the same thing, but then these things are important. You have to pay attention to. So today, and just like before, let me move on to my next slide. So I'd like to talk about the just like what we do before, the services and the role of pharmacists, and why we have to understand the importance of medication management. We have to know what we are taking, what medications we are taking, and then how they can help us. And also we try to recognize the potential risks of medication use, because we know medications, they are quite effective to help you, but then there are also risks involved. Also, we learn the strategies for promoting medication adherence, because when we get older, we take more medications and more complicated medications, and how can we make sure we are eating the correct medications. So first of all, pharmacists' roles and services, and maybe you all know that pharmacists, they dispense prescription medications according to prescriptions written by the prescribers. Yeah, that is the basic role of a pharmacist, and also to make sure patients take the correct medications and also answer inquiries that are related to medications. And sometimes we feel shy. Pharmacists are quite busy. We don't want to bother them, but they are actually our responsibilities. So because you get your medications from us, so we have the responsibilities to make sure to tell you the medications they are what they are used for, and then the risks involved. So you can ask questions. And also we try to provide vaccination services. For example, the COVID vaccinations, and also different kinds of vaccinations for flu, and these common vaccinations. That's what we do. And about 2 years ago, we started to do more things. We have expanded the scope of our practice. Things like a minor ailment assessment, like if you go online, you can find a basic College of Pharmacists. We have a list of 20-something minor ailments, and then we can also prescribe some prescription medications, because there's might be a waiting list when you want to see your family doctors, and then so you can make an appointment with a pharmacist. So first of all, the importance of medication management. Why this is so important? Well, whatever they give me, I just take, right? I just take whatever I'm given. But you have to understand why we take that medication, what it's for. So the importance is that it's easier to ask pharmacists what medications you need when you are out of medications. So you go to a pharmacist, and pharmacist would ask you, what medications are you here for? You have to know, oh, this one is for blood pressure, this one is for cholesterol, and that one is for my diabetes. So if you know what the medications are for, but sometimes it's hard to remember the names, right? So you write them down, or you take the pill bottles with you, and then you can tell clearly what you need. And also, another reason is that to minimize the chance of taking the wrong medications. So, because you will get a bag of medications, lots of bottles, and then if you don't know the names and all the functions of the medications, once you are familiar with that, then you just reduce the chance of taking the wrong medications, because you know taking wrong medications that would be harmful to your health. And also during emergency situations, like you you call the ambulance, or you just fall on the street. So it's easier for you to let, if you have a piece of paper listing all the medications you are taking, then it's easier to let healthcare providers know your list of medications that you are currently taking. Then you can get your appropriate treatment. You are on some medications and they have conflicts with other medications, right? So you have a list of medications that you are taking. You have that list on you, then it's easier for the healthcare providers to have a better understanding of your medications. And other reasons why you have to know your medications, it is to ensure the medications are not resulting in adverse effects. Because some medications, they have side effects. That's quite common, right? And then after a while, and then your body gets used to the side effects. But some medications, if there are some side effects, then they are abnormal side effects, then you have to let your doctor know or your pharmacist know, because the side effects might be quite strong. Some are quite mild, but some quite severe ones, and that would affect your daily life or make you feel dizzy or easy to fall. And those side effects, we have to take them seriously, and then which are normal ones, which are not normal, abnormal ones. And also to avoid drug interactions between medications, because between medications there are drug interactions. We try to avoid them. For example, you have a prescribed medication, and then it just so happens you have a flu or a cold, and then you get some over-the-counter flu drugs for your coughs, for your colds, and then these prescribed medications might have conflicts with your over-the-counter medications, and the conflicts you are not aware of, and then so you have to get some advice from your pharmacist to find out whether they can go together or not, because sometimes they are not supposed to go together. So once you have a clear understanding of your medications that you have been taking, then it's easy for you to get advice from your doctor or your pharmacist. And also to ensure the medications are effective and necessary. Then maybe you are on lots of medications, and some of them you've been taking for quite a few years. But maybe the diseases are already gone. It's not necessary for you to continue taking those medications. For example, something with your stomach is wrong, and then you were given a medication, but then now it's unnecessary for you to continue taking that medication. So you have to make sure you have a good understanding of whether the medication are still necessary, or because if the problems are gone, it's not necessary for you to take those medications. And pharmacists, other than what they do, they give you the prescribed medications, answering your questions. Also, they can do medication review services. You can call your pharmacy and make an appointment if you have some questions. You can, when you pick up your medications or your lots of medications that you are on, then you can want to sit down to go through the medications for 20 or 30 minutes. Yes, we are ready for that, but you just have to make a phone call to make an appointment. And then every 6 months, we can review the medications that you are on, and the medication you are taking, whether it's prescribed or over the counter, and to go through those medications and to see whether they are really effective, or to see whether they have side effects. And if there are side effects, ongoing side effects, to see whether how you are affected, some side effects, for sure there are some side effects. Some side effects are not supposed to occur. So you can sit down with the pharmacist to look at those side effects to see whether they are expected or not, or you can some other better choices for your medications to reduce the side effects. So this is something we can do. We can provide these services. So our pharmacists can provide these services. You just contact your pharmacist and to make that appointment. And these are the medication review services, 20 minutes, 30 minutes, and then you might, the pharmacist might find that some medications are necessary, some medications are not necessary. Then the pharmacist can contact your doctor with a suggestion to adjust the medications, the dosages of the medications or the medications, and then to get the optimal results. And this service is 100% free. It's sponsored 100% by the government. So don't worry about the costs or our time. Because the pharmacists, they have the human resources to help you with that.
I've said earlier to abuse medication. Actually, there's some potential risk. When you're sick, you go see a doctor. After seeing the doctor, if you are not taking medication, you will not treat the medical condition, because this person maybe psychologically you feel that after seeing the doctor I'm okay, but if you don't obey the doctor's direction and take the medication, maybe it may not be helpful to your condition. So you have to understand the importance of taking medication, taking on time. Do not overtake medication, and also do not forget to take medication. I said earlier, if you do not take the medication, actually it doesn't treat the condition. If you take too much, it doesn't mean that it's better. So you have to take regularly according to the direction. Because between medication, they have interaction, so you have to be careful. Some people, maybe they want to be thrifty. They use some expired medication so they don't have to fill again. But actually there's a potential risk for taking expired medication. A lot of the expired medication will have reduced effect. And also some medications, after a certain period of time, the chemical composition may change. So it may be harmful to the body, may be toxic. So what we see that the medication, once expired, should not be taken. You bring it back to the pharmacy. They will help you dispose. Of course, do not flush down the toilet. Bring back to the pharmacy. They will take them back. And also, if you buy your own medication, because there's a lot of non-prescribed medication for blocked nose and those over-the-counter medication to a lot of people, high blood pressure and high cholesterol or diabetes may not be useful, because it might increase your blood pressure and your blood sugar. So you have to check with your pharmacist first. Of course, you have to provide the prescription medication that you're taking to him. When you age, perhaps the number of medications might increase. Look at this picture. You look at how many bottles, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. So it's not surprising. Some people really need to take 10 or more medications. How can we take on time and without making errors? Because some you take once a day, some you take twice a day, 3 times a day. So how can we remember all that? Actually, there's a way to remember. The most original is your paper. If you're more high-tech, you use your cell phone or your electronic pad. You can write it down. At breakfast, you have to take this one, how many. At lunch, what do you take? Dinner, sometimes it's 4 times, sometimes you take 5 or 6 times. When you write down the time, then you will remember. At least in a day, you can check 4 times. That should do it: morning, noon, afternoon, and before bedtime. And also you remember the name. If you think you still do not remember, the medication must be put in front of you before you remember. Then you can go to the pharmacist to buy this package. So this would be separated into morning, noon, afternoon, nighttime. So the morning medication would be all in there, and noontime and nighttime and before bed you can do the packing yourself. You can pack for a week. Then you will not take it in error. Of course, when you pack, it has to be more accurate in terms of timing. You can ask people for help. You can also ask the pharmacist for help. At the pharmacy, we can help you package. You can see on the right-hand side, that's what is packed for you by the pharmacy. Essentially, it's the same principle: morning, noon, dinner, and before bed. When you see that, you should not forget. Some people still forget. They absolutely do not forget. They do not remember that they have to take medication. In this case, in this 21st century, is a high tech. Some pharmacy would provide a dispenser, automatic dispenser. Not every pharmacy would have. You can ask your community pharmacy whether they have it. This dispenser will be given to you to bring home at the designated time. The medication will be dispensed. It could be connected to your smartphone. If you want to know anything about this automatic dispenser of medication, you can check with your pharmacy to see whether this related service is provided. And more senior people are more senior or with some mobility problem, and they need people to go to them every day to make sure that they take medication on time. And for home visit, the pharmacy that I work in, they provide this service every day. There's a nurse or pharmacist that would go for a home visit. They would deliver the medication, and also they want to ensure that the medication previously, whether it was untaken, or whether the timing of taking, they will watch you and they give it to you to make sure you take it before leaving. And also depends on because they would come do home visit every day, and to make sure whether there's fall or any other issue or whether there's any side effect. Some pharmacy would hire the nurse or the pharmacist to go for home visit to give the medication to people. If you need this kind of services, you can check with your pharmacist. And here, there's some community resources for your reference. Say, for instance, here, HealthLink BC, the BC Health Link 811 is a 24/7 service. If you want to know pharmacare subsidy, BC Pharmacare, you can click on that link. You can find out. Actually, how much medication is covered by the government, whether there's any subsidy. And there's also fair pharmacare plan. I said earlier, pharmacists would also help you, give you injection, or if you want to know whether it's time to take the booster, say for COVID, the booster, whether it's time now, you can go online to check. if you need the pharmacy for some minor illness or some prescription medication, you can go online to find out what's the process, or you call your community pharmacy to see how they could treat minor illnesses. Okay, thank you. This is my part is done. Thank you, Barbara. Icon. Thank you, Ken. It's so telling us so in such detail why we have to take medication appropriately for senior pharmacy, and the pharmacist provide so many different services, so people, you can just go and make your inquiry, rest easy, don't be worried about troubling people when they are busy. There's some upcoming events. We are busy in July, August, September. In July, we have 2 dates that's been scheduled. One is July 12th, one is July 22nd, both in the morning, 2 different webinars. Is to do with the summer extreme weather series. One is managing chronic kidney disease during extreme summer weather. The second one is chronic disease management during extreme environmental conditions and wildfires. And also in terms of respiratory system, we have 2 speakers to talk to us. And that's in July. In August, Tuesday, August 13, using apps to support your health. We also have Wendy, who talked to us today about fall prevention. She'll talk about that topic. And on August 19, we go back to today's Q&A session. If you have any questions, you can write them and send them to us. We will arrange for speakers to answer all the questions raised. And in September, that's our annual the Success Health Fair. That's on September 15 on a Sunday. It's an all-day activity. ICON arranged for 2 speakers. One is specialist doctor to talk about chronic pain management, and the other speaker is family doctor to talk about using apps to support your health. I hope you all will pay attention. And your way of contacting us, there are many ways. You can see those on the screen. Keep in touch with us if you are subscribing to our the newsletters. You can join in this email correspondence. There will be, when there's a webinar or other activity, you'll be informed directly. ICON, thank you very much to the Patient as Partners Initiative support, and also we are thankful to our community partners. Thank you to our media partners. Thank you to all the viewing hubs community partners. Lastly, we are also very grateful. Thank you to our speakers today, including Dr. Ho, Amy Yu, etc. Lastly, we have to thank all our several interpreters behind the screen doing the interpretation for us, Shiny, Susan, Linda, Adam, and also thank you, MB Interpretation Services. And hopefully next time when we have the webinar, we'll meet with you again.